The next principle is doctor as teacher. And this speaks to the fact that a lot of what we do is to educate people about their health, the effect of their lifestyle choices such as diet, and in many ways we act as coaches as people take more and more responsibility for their health. So we're an ally with people on their journey toward better health. Last principle is prevention and wellness. And this means that whenever possible, naturopathic doctors emphasize disease prevention by assessing risk factors and looking for signs and symptoms of imbalance that can be treated before they progress into more serious disease. Again, this is the ideal. So it's not just about treating symptoms, but guiding people toward optimal wellness. And I think it's important to clarify here that wellness is inherent in everyone, no matter what conditions or diseases they are experiencing. Wellness is about a positive state of mind and taking actions in the moment towards self-care. Okay, in terms of treatment methods, or modalities as we call them, there's quite a range, but the foundation and the starting place for most practitioners is nutrition. And we do nutritional counseling, which includes looking at the diet from the point of view of helping women to meet their nutritional needs. Tracy mentioned that, vitamin D has become very popular and very well evidenced, and part of that is recognizing that most people were deficient in vitamin D and didn't even know it. And these nutritional needs can vary depending on what's going on. Another side of this, of course, is avoiding foods that have a detrimental effect on the body. Another modality or treatment method is the use of botanicals, and these are herbs that have medicinal effects, and we use botanicals from all over the world. Western botanicals, Chinese botanicals, Ayurvedic botanicals, which are from India. Another important method is acupuncture, and everyone nowadays is familiar with this ancient technique, which is good for a variety of conditions, including female reproductive issues. Another important modality is homeopathy. And this is a system in and of itself that uses very diluted substances to treat symptoms. And I find a lot of people confuse the terms homeopathy and naturopathy, but they are different. And homeopathy is just one way of working under the umbrella term of naturopathic medicine. We also do lifestyle counseling, which includes supporting people in making lifestyle choices, whether it's exercise or stress reduction techniques such as meditation, or giving up unhealthy habits. The last modality I'm going to mention is body work, and this refers to a variety of hands-on techniques for working with the body. Okay, speaking more specifically in terms of treatment for ovarian cancer patients, first of all, it's important to emphasize that this refers to complementary care in conjunction with a conventional medical doctor and/or oncologist. And I'll briefly just give you an idea of how we would approach this. First of all, around surgery, nutritional and homeopathic support for healing and recovery, this can be very helpful and done in a way that does not interfere with the surgery itself or the use of other medications. Nutritional support during chemotherapy. This is a controversial area and one in which the evidence is still emerging. Suffice it to say that if any adjunctive treatments are used, it is determined strictly on an individual basis and as a result of looking at available research. The immune system is undoubtedly important, whether one is fighting a common cold virus or cancer cells. And this is an area where nutritional supplements and or botanicals are very effective. Low energy is another common complaint, especially after conventional treatment. And here again, there are a number of effective ways of boosting energy. Another approach would be to optimize the diet, so we're back at nutrition. And it's important to meet nutritional needs because nutrients support healing. And also diet is important as part of the overall game plan to decrease risk of recurrence. Another approach we take is to improve digestive function, and the way your gut works is crucial to your overall health. As an example, something many people don't realize is that the healthy bacteria living in the intestines contribute to the state of the body's immune system. So this is important to address. Supporting liver function. Sometimes this is needed and can be achieved with the use of certain botanicals and or amino acids. I find people on certain medications may have side effects such as nausea, and the use of a safe and gentle botanical can often ameliorate that. And the last thing I want to mention in terms of specifics is maintenance of healthy blood parameters. Sometimes overall white blood cell counts will go low during or after treatment, or certain types of white blood cell counts will go low in cancer patients, and there are botanicals that are very effective in keeping these levels up. So that's an overview of naturopathic medicine. I hope I've given you an idea of how we work, and I think at this point we're ready to take whatever questions you may have.
Your first question comes from Maria. Please go ahead.
I'd like some information about the flora essence and also glutamine.
Okay, Tracy, would you like me to take that?
Please do.
So the first one, fluorescence, is a botanical formula. It's a combination of a few different herbs, and this formula is very good at detoxifying the body. Contains some blood cleansers. So a number of women choose to use this after their conventional cancer treatment.
Okay.
You also asked about glutamine.
Yes.
Glutamine is an amino acid, and it's actually, it nourishes some of the important cells in the intestines, and has a couple of different effects that we know about. It appears to be good in enhancing the immune system. You'll also find that bodybuilders use it because it helps with muscle tissue.
I'm taking this at the moment. The doctor recommended it, my oncologist.
Mm-hmm.
It's for my nerve endings that they are a bit numb.
Mm-hmm.
And it's good for that. That's what they recommended me to take that, and then I feel that it's very helpful. And also I wanted to know the fluorescence. Since I'm taking glutamine, can I also take the fluorescence at the same time? I didn't try it yet, but I heard that it's very good for, as you say, it's like a blood cleanser, right?
Mm-hmm. To the best of my knowledge, I can't see any problem with taking both of those at the same time.
Yeah, because I'm not in chemo at the moment. I finished a few months ago.
Mm-hmm.
Yeah, so
Good.
Is it the tea batter or because the fluorescence comes in a different ways, right? Like it comes in a tea or liquid, I think.
They're both good. I think it's two things. Just make sure that you buy, a reliable brand, and I think whatever is easier for you and whichever form that you would actually take it is what is important.